Top 25 Clinical Nursing Scenario Interview Questions and Answers. Clinical nursing scenario interview questions are designed to assess a candidate's critical thinking, clinical judgment, communication skills, and ability to provide safe patient care in real-world situations. Employers use these questions to evaluate how nurses respond under pressure, prioritize patient needs, collaborate with healthcare teams, and handle emergencies. Preparing thoughtful answers can help candidates demonstrate their professional competence and confidence. The following 25 clinical nursing scenario interview questions and answers provide practical examples that highlight key nursing skills and decision-making abilities expected in modern healthcare environments. 1. How would you handle a patient whose condition suddenly deteriorates? If a patient's condition suddenly deteriorates, I would immediately assess airway, breathing, circulation, and vital signs. I would stay calm, call for assistance, notify the physician or rapid response team, and follow emergency protocols. Continuous monitoring and documentation are essential during the event. I would also reassure the patient and family while ensuring all necessary interventions are performed promptly. Effective communication with the healthcare team helps ensure coordinated care and improves the patient's chances of recovery. 2. What would you do if a patient refused a prescribed medication? When a patient refuses medication, I would first remain respectful and avoid forcing treatment. I would ask the patient about their concerns and provide clear education regarding the medication's purpose, benefits, and possible side effects. If refusal continues, I would document the situation accurately and notify the physician. Respecting patient autonomy is important while ensuring they have enough information to make an informed decision. Maintaining trust and open communication often helps resolve concerns effectively. 3. How would you prioritize care for multiple patients? I prioritize patient care by assessing urgency, severity of conditions, and potential risks. Patients with life-threatening issues receive immediate attention, followed by those whose conditions could worsen quickly. I use clinical judgment, hospital protocols, and nursing assessment findings to determine priorities. Effective time management, delegation when appropriate, and continuous reassessment help ensure all patients receive quality care. Remaining organized and flexible allows me to adapt to changing situations while maintaining patient safety and efficient workflow. 4. What would you do if you noticed a colleague making a medication error? Patient safety is always my priority. If I noticed a colleague making a medication error, I would intervene immediately if possible to prevent harm. I would report the incident according to hospital policies and ensure appropriate monitoring of the patient. Afterward, I would support a culture of learning rather than blame. Accurate documentation and communication with supervisors help address the issue appropriately. Reporting errors promotes patient safety and helps prevent similar incidents in the future. 5. How would you respond to an angry patient or family member? I would remain calm, professional, and respectful while actively listening to their concerns. Often, patients and families become upset because they feel unheard or anxious. I would acknowledge their feelings, clarify misunderstandings, and provide accurate information when appropriate. If needed, I would involve a supervisor or healthcare provider to assist with resolution. Maintaining empathy and effective communication can de-escalate tension and build trust. My goal is always to address concerns while ensuring a positive care experience. 6. How would you manage a patient experiencing severe pain? I would begin by assessing the patient's pain level, characteristics, and contributing factors. After reviewing prescribed orders, I would administer appropriate pain relief interventions and monitor their effectiveness. Non-pharmacological methods such as repositioning, relaxation techniques, or comfort measures may also be helpful. Continuous reassessment ensures the treatment is working and allows adjustments if necessary. I would communicate findings with the healthcare team to ensure comprehensive pain management while prioritizing patient comfort and safety. 7. What would you do if a patient fell in your unit? If a patient fell, I would first assess for injuries without moving them unnecessarily. I would check vital signs, level of consciousness, and overall condition. Following facility protocols, I would notify the physician and supervisor. Document the incident and complete required reports. The patient would be monitored closely afterward. I would also evaluate contributing factors and implement preventative measures to reduce future fall risks. Patient safety and thorough assessment are critical after any fall event. 8. How would you handle a conflict with another healthcare professional? Professional collaboration is essential in healthcare. If conflict occurred, I would address the issue respectfully and privately, focusing on patient care rather than personal differences. I would listen to the other person's perspective and communicate my concerns clearly. Finding common ground and working toward a solution benefits both the team and patients. If necessary, I would seek guidance from management. Maintaining professionalism and open communication helps create a positive work environment and supports effective patient outcomes. 9. What would you do if you suspected patient abuse? If I suspected patient abuse, I would carefully assess the situation, document objective observations, and follow legal and organizational reporting requirements. Patient safety is the highest priority. I would report concerns to the appropriate authorities and healthcare professionals responsible for investigation. Maintaining confidentiality while ensuring proper action is important. Nurses have an ethical and legal responsibility to advocate for vulnerable patients. Prompt reporting can protect patients from further harm and ensure appropriate support services are provided. 10. How would you educate a patient with low health literacy? I would use simple language, avoid medical jargon, and provide information in small, manageable sections. Visual aids and demonstrations can improve understanding. I would use the teach-back method by asking the patient to explain information in their own words. This confirms comprehension and identifies areas needing clarification. Education should be individualized to the patient's learning needs and preferences. Effective communication helps patients participate in their care and improves treatment, adherence, and health outcomes. 11. What would you do during a cardiac arrest situation? During a cardiac arrest, I would immediately activate emergency response protocols and begin CPR according to current guidelines if indicated. I would ensure emergency equipment is available and assist with advanced interventions as directed. Clear communication with the resuscitation team is essential. Accurate documentation of events and interventions would follow. Remaining calm and focused helps ensure effective teamwork. Rapid recognition and prompt action significantly improve the chances of successful resuscitation and positive patient outcomes. 12. How would you manage a patient with breathing difficulties? I would assess airway patency, respiratory rate, oxygen saturation, lung sounds, and overall respiratory status. Depending on findings, I would position the patient appropriately, administer oxygen as prescribed, and notify the healthcare provider. Continuous monitoring is necessary to identify changes quickly. I would remain with the patient if symptoms were severe and prepare for emergency interventions if needed. Prompt assessment and intervention can prevent further deterioration and improve respiratory function and patient safety. 13. What would you do if a physician's order seemed incorrect? If an order appeared incorrect or potentially harmful, I would verify the information before carrying it out. I would review the patient's condition, medical records, and relevant protocols, then contact the physician for clarification. Patient safety must always come first. If concerns remained unresolved, I would follow the chain of command according to organizational policy. Nurses have a responsibility to advocate for patients and ensure treatments are appropriate, safe, and evidence-based before implementation. 14. How would you handle a patient who frequently uses the call bell? I would assess why the patient is frequently requesting assistance. The behavior may indicate pain, anxiety, loneliness, discomfort, or unmet needs. Addressing the underlying issue often reduces repeated calls. I would establish a routine for checking on the patient and ensure necessary items are within reach. Clear communication about expectations and available support can also help. Providing compassionate care while maintaining efficiency ensures the patient's needs are met appropriately and consistently. 15. How would you respond to a patient experiencing anxiety? I would approach the patient calmly and provide reassurance while assessing the cause of anxiety. Active listening allows the patient to express concerns and feel supported. I would explain procedures clearly, encourage relaxation techniques, and create a calm environment whenever possible. If anxiety became severe, I would notify the healthcare provider and follow prescribed interventions. Emotional support, effective communication, and patient-centered care are essential in helping patients manage anxiety and feel more secure. 16. What would you do if a patient developed an allergic reaction? I would immediately assess the severity of the reaction, including breathing difficulties, swelling, skin changes, and vital signs. Emergency assistance would be requested if necessary. I would stop any suspected causative medication or treatment according to protocol and administer prescribed emergency medications. Continuous monitoring and documentation are important throughout the event. Prompt intervention can prevent serious complications. Effective communication with the healthcare team ensures the patient receives timely and appropriate treatment for the reaction. 17. How would you maintain patient confidentiality? Maintaining confidentiality involves protecting patient information at all times. I would only share information with authorized individuals directly involved in care. Discussions regarding patients would occur in private settings, and electronic records would be accessed only when necessary. Following organizational policies and privacy regulations helps safeguard sensitive information. Respecting confidentiality builds patient trust and supports ethical nursing practice. Patients should feel confident that their personal and medical information is handled responsibly and securely. 18. How would you care for a patient with dementia? When caring for a patient with dementia, I would use clear, simple communication and maintain a calm, structured environment. Patience and empathy are essential. I would orient the patient frequently, encourage familiar routines, and ensure safety measures are in place. Involving family members when appropriate can provide valuable support. Monitoring for changes in behavior or condition is important. Individualized care helps reduce confusion, promotes comfort, and supports the patient's overall well-being. 19. What would you do if you were assigned an unfamiliar procedure? If assigned an unfamiliar procedure, I would seek guidance and ensure I fully understand the process before proceeding. Patient safety requires competence and preparation. I would review policies, consult experienced colleagues, and ask questions when necessary. Continuous learning is an important aspect of nursing practice. Performing procedures only within my level of competence, while obtaining appropriate support, helps ensure safe and effective patient care. Professional responsibility includes recognizing limitations and seeking assistance. 20. How would you deal with a heavy workload during a busy shift? During a busy shift, I would stay organized, prioritize tasks based on patient needs, and manage time effectively. Delegation would be used appropriately within team roles and responsibilities. Continuous reassessment helps identify changing priorities. Clear communication with colleagues supports teamwork and efficiency. Remaining calm under pressure enables better decision-making. While managing multiple responsibilities, I would ensure patient safety and quality care remain the primary focus throughout the shift. 21. How would you respond to a patient with signs of sepsis? I would recognize early signs such as fever, altered mental status, low blood pressure, increased heart rate, and abnormal laboratory results. Immediate assessment and rapid communication with the healthcare provider are critical. Following sepsis protocols, obtaining cultures, administering prescribed treatments, and monitoring vital signs closely are essential actions. Early recognition and intervention significantly improve patient outcomes. Nurses play a vital role in identifying sepsis and initiating timely responses to prevent severe complications. 22. How would you handle end-of-life care discussions? End-of-life care requires compassion, empathy, and respect for patient wishes. I would listen carefully to the patient and family, provide accurate information, and support informed decision-making. Maintaining dignity and comfort is a priority. Collaboration with the healthcare team ensures consistent communication and care planning. Emotional support is important during this difficult time. Respecting cultural, spiritual, and personal preferences helps create meaningful and patient-centered end-of-life experiences for patients and their loved ones. 23. What would you do if a patient was non-compliant with treatment? I would first explore the reasons behind the patient's non-compliance. Factors may include financial concerns, misunderstanding, fear, cultural beliefs, or side effects. Understanding the root cause allows me to provide appropriate education and support. I would collaborate with the patient to identify practical solutions and encourage shared decision-making. Respecting patient autonomy while promoting informed choices helps improve adherence. Building trust and maintaining open communication are key to addressing treatment challenges effectively. 24. How would you prevent healthcare-associated infections? Preventing healthcare-associated infections begins with strict adherence to infection control practices. Hand hygiene, proper use of personal protective equipment, and maintaining a clean environment are essential. I would follow isolation precautions when indicated and educate patients and families about prevention measures. Monitoring invasive devices and removing them when no longer necessary also reduces risk. Consistent compliance with evidence-based infection prevention strategies protects patients, staff, and visitors while improving overall healthcare quality. 25. How would you ensure patient-centered care? Patient-centered care involves respecting each patient's preferences, values, and individual needs. I would actively involve patients in decision-making and encourage open communication. Listening carefully to concerns and tailoring care plans accordingly helps improve satisfaction and outcomes. Collaboration with families and the healthcare team supports comprehensive care. Treating patients with dignity, empathy, and respect creates a positive healthcare experience. Patient-centered nursing focuses on delivering care that aligns with each person's goals and priorities. Clinical nursing scenario interviews evaluate a nurse's ability to apply knowledge, make sound clinical judgments, communicate effectively, and maintain patient safety in challenging situations. Success in these interviews requires demonstrating critical thinking, professionalism, compassion, and adherence to evidence-based practices. By preparing for common scenario-based questions, candidates can confidently showcase their nursing competencies and problem-solving skills. The 25 questions and answers presented above cover a wide range of clinical situations frequently discussed during nursing interviews, helping candidates strengthen their preparation and improve their chances of securing nursing positions.